So Lizzie and Jocelyn had the ankle, their lower leg, ankle, and foot. And so as we go into there, I'm going to kind of just go breeze through here pretty quick and show you kind of where to focus on when you look at this stuff. So in the lower leg, we have our medial tibia, lateral fibula. You can see some of those information. Really, it's going to be the landmarks that you're going to be focused on the rest of this class, and so that way you can have an idea when you see the medial malleolus, lateral malleolus. When you see fibula, you'll know that there's the tibiofibular joints that you have there, the fibular head, those kind of things. Another picture kind of gives you an idea. There's the interosseous membrane that you'll see, and I'm not going to pick too much on the soleal line. I kind of got rid of that. That'll be important later, but for right now, these are the landmarks I want you to note. The foot is going to fit. In fact, the talus is going to fit right up under here. This is that ankle mortis that you'll hear, but you don't have to worry about that yet. This is a good picture of our foot bones, the tarsals, metatarsals, phalanges. The little sections here's our tarsals, metatarsals, 1 through 5, and then all of our little phalanges. This is good information here, basic stuff that you'll need to know. I also like this picture here. This is a good picture that kind of gives you a good aspect of all that. So this is a good one to not only review but study, as far as to make sure that you can identify stuff on this picture. When we talk about the bony landmarks of the foot and ankle, yeah, you see a lot of bones. So yes, we want you to identify the bones and where those are. You'll see the medial and lateral malleolus from the tibia and fibula. Those should be pretty easy. All the metatarsals, you should be able to count those. Phalanges is good. Here's the one I'm going to pick on right here, this fifth metatarsal tuberosity. Make sure you have an idea where that is. That's an important one. So be able to look at that landmark itself. As we go into the joints, you can see something like this. When you see something like this, the tibiofibular joint, if you see just a blank line, if I didn't have a label here and I just had a line to right here, you would probably identify that as the head of the fibula. Now, if I asked you, if I extend that line to right there, this one's almost to right there. If I ask you what joint am I pointing at, then you would come in with, yes, this is a tibiofibular joint, and you should know this is a syndesmosis joint, that kind of stuff. I'm not going to be concerned too much about the motions of the syndesmosis joints. Just know that there's some gliding and sliding from each of them. The talocrural starts the important joints of the ankle. And so that is where we get, here's that ankle mortis that I showed you earlier. It's mostly the tibia and that talus that comes in here. And this is where we get our dorsiflexion, plantar flexion. And you can see the motions that are there. You can see the actual degrees of motion that are there as well. When you go below that that talocrural joint, I'm already getting there, that subtalar joint. So now we get below, talus is right here, calcaneus is right there. There's your subtalar joint, and there's your inversion, eversion. We got to know what those are. Inversion, if you invert your foot, you have a lot more motion than you do with eversion. That's a good way to figure out which way, which motion it is. As you get down the foot, though, so that's your ankle. Those are the two main ankle ones. This is a good picture here because it kind of gives you the rest of. It does give you the subtalar joint. It does give you the talocrural joint, but you can see some of the other midfoot joints. I'm not going to get too individualized. In fact, I took a lot of their stuff out because they got individualized with cuneiform, metatarsal. We don't need to get too much into those. Usually we just call it midfoot or tarsal metatarsal joints. You will need to know the term Lisfranc, not for me, but for Tim's class. I'm going to pick back up and make you understand or make you note the metatarsal phalangeal joints and the interphalangeal joints, specifically the distal and proximal interphalangeal joints as you go through. Now, I've said this before, each joint, wherever there's a joint, there's a ligament. So when you start talking about ligaments, you just go back to the joints. There's our tibiofibular, you have the proximal and distal. Here's our interosseous membrane. This is a super important slide. These 3 on the lateral, the one main one on the medial side, these are your ankle ligaments. You have to know not only what they are, where they are, and really the lateral ankle ligaments are going to try to resist the inversion, and the deltoid medial ligament is trying to resist eversion. And so I'll give you a picture of, here's the deltoid ligament. Really, this whole thing is the deltoid ligament, as you see. And so it's just this big, broad band of ligament. So make sure you know these. Make sure these are important ligaments. You will need to know those going into July, really for this class, and then going into July. A little bit more information. I'm not going to ask you too much about this stuff, but a nice big picture of that first picture that I liked. These ladies included the plantar fascia. Fascia is basically ligamentous type tissue, but it's, kind of different. But anyway, so you can see the plantar fascia. I'm not going to worry about. In fact, I took out a lot of the different. They separated them into different components: medial band, lateral band. I did, for you guys right now, I just want you to have an idea where the plantar fascia actually is. And then the other ligament that we have is this spring ligament, calcaneonavicular ligament. You'll see it was actually on some of the other, I think it was on this photo. No, it was on another photo. I'm not going to go searching for it while I'm recording. But here's your spring ligament. Oh, there it is. There's spring ligament right there. Here's your spring, calcaneal navicular ligament. That's an important one that you will talk about, and I want you to know that for this class. Muscle wise, it's not too bad. There's 4 compartments of the lower leg that you really need to focus on. The superficial posterior is basically your calf muscle, gastrocnemius soleus. I took out the plantaris. They had plantaris in there. I didn't want to get too much in the weeds with this stuff, origin, insertion, action. I do want you to know where it is. So you may have to identify this extra plantaris underneath the gastrocnemius. Gastrocnemius has been cut, but you will need to know that the gastrocnemius soleus, their action is mainly plantar flexion, and that's the only thing I'm really going to focus on right here. If you want to know plantaris inserts at the same place, has the same action, a little bit different origin, but I'm not going to make you responsible for that one quite yet. As we go into a little bit deeper, so now we've gone back underneath the soleus. Now you have 3 muscles in the posterior deep, and so you have the tibialis posterior, flexor digitorum, so digits. That's going to flex the digits or your toes. Make sure that you know. Oh, I didn't put those on there. It's the flexions of toes 2 through 5. I put it on the other ones, you'll see, but it's actually toes 2 through 5 because hallucis is here. That's your big toe, and this is the flexor hallucis, which means it's going to flex your big toe. So make sure you know where those are, and then really what they do. That's your posterior deep. Because the posterior deep, they are specifically arranged in a certain order. So if you were to palpate, this is the medial malleolus, and then if you go in order, it would be the tibialis posterior, the flexor digitorum longus, and the flexor hallucis longus. And I've separated those individually, but that's a way that's the way I learned it. I've taught like that. It's a good way to remember those. Tom, Dick, and Harry, when you're in that posterior deep, tibialis, digitorum, hallucis, they're all flexors. This little guy right here does inversion, which is really important. And hopefully that's a good way that you can keep track of those. Then when we get to the lateral side, we'll move ourselves around the lateral side. There's two muscles. There's a longus and a brevis. Both have the same name, and so it's easier to, when you see a diagram, the longest one goes all the way up to the fibula, and the small one comes here. So the other thing you can look at is the brevis actually inserts at the base of the 5th metatarsal. If you want to poke on that one, that would be the peroneus brevis, and then as opposed to the peroneus longus. These ladies identified it as the fibularis longus, fibularis brevis. You'll see both of those. They put the picture of fibularis longus, fibularis brevis, but you'll also see peroneus longus, peroneus brevis. I just want you to have an idea of both of those. That, when you see either of those, that's we're talking about those lateral leg muscles, lateral lower leg muscles that evert the foot is the main one, with a little accessory plantar flexion. All right, the final one from the muscle side is the anterior compartment of the lower leg. And then we get into tibialis anterior, extensor digitorum longus, extensor hallucis longus. This is the same Tom, Dick, and Harry muscles. They're just not in the same order as they are in the posterior, so we really don't use it. But it's the same kind. It's just make sure that you're in the anterior compartment, and now we're extending toes 2 through 5 and extending the big toe right there as you go through there. I did not want to get any more in depth into the foot musculature because it gets really, really intricate. So for this class, I just kind of limited it to the lower leg muscles. Same thing really in the neurovascular stuff. I didn't want to get too involved here. So really what I want you guys to have an idea is the posterior tibial artery. There it is, posterior tibial artery, and that dorsal pedal pulse. Those are the 2 pulse points that you'll need to know. And then on the nerve side, there's not much here. We have the big sciatic nerve that the knee people will talk about. You should know common peroneal nerve. You should know tibial nerve, and really that's what I want you to know. The common peroneal nerve will separate into superficial deep peroneal nerves, but ultimately those first 2 are the ones I really, really, really want you to know. And then again, like I did on the other ones, I gave you some pictures to go through here and try to label on your own, both muscles and ligaments and all that kind of stuff. So good luck.